This is Jerry Hesch of the Hesch Institute in Aurora, Colorado. I practice orthopedic manual physical therapy. My client is a, 35-year-old?
27.
27-year-old
Yeah.
physical therapist who drove up from
Colorado
Springs to see me in Aurora, Colorado. And we've been treating foot pain, okay? But I'm going to have him describe his recent left knee pain and knee symptoms.
So I've been feeling some...
Louder.
So I've been feeling some knee pain, patellar pain, with lunges this past week at the gym. And that's relatively new. I've had things like this in the past, but that seems to be new. Obviously we're finding some things out today, but it's been a little irritant just doing exercises recently.
And you also felt like the knee was rotated outward?
Yeah, it seems like it's kind of stuck, at least my lower leg bone, my tibia, seems like it's rotated, over-rotated. My femur is rotated maybe the other way.
Okay.
So I'm just figuring out why that's doing that.
Yeah. So I'm going to test internal rotation of the femur. I can't do it. It's lacking. Okay, I cannot internally rotate that femur, and that's a normal movement. There's a normal little bit of play available, and I can do it on this side. Okay? Now I'm going to test external rotation, and there's a little bit of play, okay? And I'm going to test external rotation on this side, and there is no play. Okay? Visually, your left femur is more posterior. So if I bring your legs close together, okay, and then if I bring my thumbs across, this seems about 1/4 of an inch deeper. Okay, now you have, just relax, you have medial and lateral play in your right patella, and if I squeeze that patella, there's a little bit of a lift, okay? And there's a little bit of inferior glide mobility. On the left knee, there is a little bit of inferior glide mobility, okay? When I squeeze it and try and lift it, there's no movement. And when I go laterally, there's a little bit of movement and then it stops. When I go medially, same thing, just a little bit of give. Whereas on this side, the movement is greater. Okay? And I'm going to try superior glide, and you certainly have play in the right knee. And you don't have superior glide of this knee. Let's test external rotation of the femur, of the tibia. Okay, so you have external rotation play on the right, and you should have a little bit of internal rotation. I've seen it, in comments online that you don't have any internal rotation in full extension, but my experience in the clinic tells me otherwise. You have a little bit of play. Okay, so now we'll test external rotation of the left tibia, and there is no play. And I'm going to test internal rotation as well, and there's no play. I'm trying to make it go like this. Okay, so that play is lost. I'm submitting that I have no idea how you did this, but somehow this femur got stuck in posterior glide. Okay, we could also test knee extension. So I'm lifting the left heel up. You have more on this side. Can you tell?
Oh yeah.
Okay, and we could look at flexion, and we would typically find reduced flexion. So I can fit 4 fingers there. Looks like 5 fingers. Okay. I see this on occasion, and it's very simple to correct, and I believe that it's a one-time correction. There's a couple of ways of doing it. You could do it with you lying prone and me leaning on the thigh just above the knee. So let's do that technique. Let's have you lie on your stomach. And yeah, scoot down so your feet are off the bed. Okay. So this is in your left leg. And what I'm going to do is prop the lower leg with 2-inch foam. So with one hand, I'm going to stabilize the ankle, okay? And then this is the crease of the knee. So then with the other arm, I'm going to push down firmly on the femur, okay? I'm going to set a timer for 3 minutes, and I'll come back and film the response to this treatment.